Well, today we're going to discuss deciduous canines. They're puppy teeth. In mammals, when we're young, we have a set of teeth. And then when we're older, the adult teeth grow in with a very particular occlusion. What that means is the teeth grow in exactly where they need to be to slice and dice. Other animals, like reptiles, crocodiles, they have very pegged, pointed teeth. And they just close, open and close, and they're just there to bite. But in dogs, they have the premolars, which are shearing. And what happens is, as a dog chews on meat and bone, they act like scissors and they slice and dice. So those are the adult teeth that come in at a very precise orientation to perform that function. The canines come in, and the original role of the canines is to hold the prey. But the canines are supposed to knock out the deciduous teeth, the baby teeth. If they don't, they will the deciduous teeth will stay in there, and this little tiny gap between the deciduous baby teeth and the adult tooth will collect stuff like this hair and junk in there, and then that will get into the gap, undermine the gums, and let the bacteria get in there for infection. So we're going to take that deciduous tooth out today, but the rest of the teeth look good, and there's no deciduous canine on this one. It fell like it should have. So we elevate the gum away from the tooth. We loosen the tooth from the underlying attachments. We try not to disturb the adult tooth because we don't want it to be unhappy. We want to take out the deciduous canine. So our little dog is blissfully sleeping, and you can hear the monitor going off, which means everything's good. The color's nice and pink, which means there's lots of oxygen going through the lungs and the veins and arteries. So as you can see, it's getting loose now, and we'll be able to take and pull it right out. There it is. And the little divot that's left, it's like in a golf course, the little divot that's left is just that little tiny area of gum that should heal up next to the adult canine and be fine. Well, that's what we do when we take out deciduous teeth. It's not a very hard procedure. Usually they're very shallow roots and they come out pretty easily. Most of the time we take them out when we neuter animals. And in this case, we saw the dog after it was neutered, and it wasn't taken out during the neutering. So you can always check your puppy's teeth to make sure that that little tiny needle deciduous or baby tooth is out when you consider neutering your pet, and mention to the veterinarians or the hospital to make sure and get it out of there when you have it neutered. Most of these little baby teeth will come out naturally. Sometimes in small breed dogs, they have a little bit tweaked dentition, or they're smaller, or their muzzles are different because they're bulldogs, they're squish-faced dogs. They may have retained baby teeth because of that. But anyway, I hope you enjoyed it. Check out Dog Dish Diet if you want to feed your pet a little differently. Cook for your dog, or feed your pet to avoid the vet if you want to cook for your dog or cat. And if you do cook for your animals, remember, every animal needs a source of calcium. So you've got to feed them either raw bones or eggshells or a calcium supplement. Have a great day.